Let's briefly cover some fluid and electrolyte imbalances, the mechanisms, the treatments, the causes. This presentation makes a very good handout. We'll discuss fluid imbalances, physical mechanisms, what the causes are, symptoms that you may see, and the treatments as far as IV therapy goes. With isotonic dehydration, the sodium and water lost is in equal amounts. This can happen with vomiting and diarrhea. Their skin gets dried out. They get a drop in blood pressure, a drop in pulse, decreased urine output. There'll be weight loss, weakness, and just generalized lethargy. We usually treat this with 0.9% normal saline, which is an isotonic solution, and it'll automatically increase the blood volume and therefore increase blood pressure. With hypertonic dehydration, there's an increase in sodium but a loss of water. There's usually an increase in your hematocrit and hemoglobin when the blood test is done. You worry about patients that have diabetes. They can have hyperosmolar states. They'll have an increase in blood sugar. This state causes severe dehydration, increase in osmolality. In other words, you have more of those solutes in the bloodstream than you normally have. You also run the risk of coma and death. Causes of this is water loss, sweating, insufficient intake of water and fluids. Some of the symptoms are confusion, thirst, confusion and stupor, poor skin turgor. If you go to pinch it up, it just kind of sits there as a tent. Individuals may be irritable. They may be in a coma. We give them D5W first, dextrose 5% in water, just to get them hydrated, and then we usually change them to 1/3 or 1/2 normal saline solutions. Individuals that have hypotonic dehydration, they have a sodium loss, which is greater than water loss. They have a decrease in your sodium concentration, a decrease in your osmolality. Again, the particles that are dissolved into your extracellular fluids. This is caused by diuretics, vomiting, sweating, burns. The symptoms they'll have is poor skin turgor. You can pinch up their skin and it'll sit up there like a tent. Nausea, vomiting, headaches, abdominal changes, cramping, diarrhea, generalized weakness. We usually treat these individuals with 0.9% normal saline, IV. That is an isotonic solution. And then D5 normal saline to give them a little bit of dextrose to use for energy for the cells. With individuals that have isotonic overhydration, there's really no specific osmolality on their lab results that would tell you this is going on. The sodium remains in the same plasma level, and it's usually due to a large amount of fluid intake, whether it be water, alcohol, sports drinks, doesn't matter. The symptoms are an increased intake of more than the output. There's a weight gain, they have bounding pulses, they can go into circulatory overload, heart failure, and edema. We have to restrict their fluid intake to try to reduce the effects of this disorder. Individuals that have hypertonic overhydration, there's an increase of fluid in the extracellular spaces. The causes are hypertonic fluid infusing, and it's infused too quickly. The signs are pulmonary edema, shortness of breath, anxiety, restlessness. They can cough and have a foamy sputum, heart palpitation, chest pain if the heart's involved. The treatment for this is diuretics, a lot of times Lasix, to try to get rid of some of this fluid. Individuals that have hyponatremia or sodium level less than 135. Some of the physical mechanisms of this can be gastroenteritis caused by disease processes, renal disease, congestive heart failure, nephrosis of the kidneys, renal failure, hypothyroidism, Some of the causes are GI secretion loss, biliary or some type of GI fistula they may have, fluid loss shifts so that the sodium is not lost. Some of the symptoms are headache, muscle weakness, anxiety, apathy, anorexia, seizures, and mental confusion. The treatment is normal saline or D5 1/2 normal saline, and we infuse it slowly. Individuals that have hypernatremia, too much sodium content, it's generally caused by some type of fluid and electrolyte imbalance. Could be secondary to a disease process, could be to burns, diarrhea, sweating, dehydration, edema, increased renal intake with poor renal function, or in the diabetic they can have sugar in their urine, high levels. Some of the symptoms are thirst, dry mucous membranes, urine output, flushed skin. And we usually treat this with D5W. Individuals that have hypokalemia or a low potassium balance is generally caused by some type of disease process of imbalance. It can be caused by a GI loss, a urine loss from diabetic therapy, individuals that are on potassium-free diets, any type of diet or condition that causes pH changes, kidney disease, or an increase in sodium intake. These individuals will complain of muscle cramps, paralysis, mental confusion, numbness and tingling, postural hypotension. They'll go to get up and get dizzy and maybe fall or faint. They'll have weak, irregular pulses. They'll have EKG changes and T waves, QT waves, and U waves. The treatment for this is we always go with PO first. We try to take care of that first before we give them IV potassium, because potassium is very irritating to the skin. If we give potassium, we're going to use a smaller IV catheter, such as a 22, so that way we can dilute it down with the blood volume the individual has. There's a very important warning. We should never give potassium and give potassium by IV push. Potassium should only be given by licensed personnel and under their supervision, because this can cause cardiac arrest. We usually give these pushes over 20 minutes. Individuals that have hypocalcemia, usually caused by a fluid and electrolyte imbalance. Causes are decreased calcium intake or lost by the kidneys, vitamin D deficiency, diarrhea, hypothyroidism, individuals receiving large amounts of blood products such as in a trauma. Some of the symptoms are muscle tremors, spasms, numbness and tingling around the mouth and fingers, decrease in contractility of the muscles, emotional disturbances, EKG changes. They can go into a depression and coma. Again, you can check the Trousseau sign or the Chvestek sign right at the bedside. You don't need a lab result for that. Some of the treatments are calcium gluconate or calcium chloride, and increase the intake of milk products. Individuals that have hypercalcemia or a high level of calcium causes a fluid and electrolyte imbalance. Some of the causes are increased intake of vitamin D and hyperthyroidisms, disease processes such as bone metastasis or sarcoidosis. Some of the symptoms are anorexia, nausea, fatigue, constipation, excessive amount of urine such as a diabetic, polyuria, dehydration, EKG changes, low heart rate, and even heart block. We usually restrict the calcium intake for these individuals to prevent calcium stones. We usually give IV fluids and loop diuretics to help excretion of the calcium and promote renal excretion of calcium. We also need to determine if they do have some type of a tumor that can be causing this problem. Individuals that have hypochloremia, which is not enough chloride. This fluid and electrolyte imbalance can be caused by bicarb deficiency, dehydration, nephritis, eclampsia, anemia, cardiac disease. Unfortunately, it rarely presents symptoms. We usually find it on a lab result. And then what we do is we treat the cause of what's causing the low level of chloride. Individuals that have hypomagnesemia or low levels of magnesium. This imbalance is often found in patients that have GI problems such as bowel resections, inflammatory bowel disease, patients that have hypocalcemia, patients that have hypokalemia, chronic alcoholism, severe diarrhea. Some of the symptoms are the same as hypocalcemia and leg and foot cramping, tremors, cardiac arrhythmias, difficulty swallowing, paralytic ileus. We usually give magnesium slowly. It's done by licensed personnel, and we do not give IV push. For individuals that have hypermagnesemia or too much magnesium, and this electrolyte imbalance can be caused by renal failure or ingestions of too many antacids, such as these individuals that just eat Tums all the time that contain magnesium. Diabetic patients that are in diabetic ketoacidosis, or patients that have leukemia. Some of the symptoms are muscle weakness, diaphoresis, decreased respirations, flushing, decreased reflexes, decreased level of consciousness. It's generally treated with intravenous calcium gluconate by licensed personnel.